I didn't know what to do. I didn't know how to stop the bleeding, and it was really bleeding.
He knew he had varicose veins. He had no idea they could rupture. People of all ages can get them. So how do you treat them before there's a problem? And we'll explain the heart connection. That's on today's All Things Heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, April 6th. I'm Alexis Del Cid. Welcome back to All Things Heart. Today we're talking about something that affects 2 out of every 10 adults, varicose veins. Those bulging bluish veins that have us covering our legs at the pool. We will explain how to treat them and the risks that could be involved if you don't get them treated. And we love giving you a little glimpse at what our doctors are like outside the hospital walls. And this doctor, he's a one-man adventure machine with a soft side. That's coming up on Behind the Mask. You're gonna love that. And we love your questions and comments because they're the heartbeat of every episode. So be sure to send them to us on YouTube, Facebook, and to the All Things Heart email. You'll find all the links right here on your screen. Now to varicose veins. They can be so much more than unsightly. They can make your legs feel heavy and tired. For some people, they itch. For others, they're downright painful. Many people learn just to live with it, like the man you're about to meet, until something scary happened, and that's what prompted him to take action.
This is a really good section here.
Bob Trapp is living his dream.
And it's my home. So coming to work every day is like going home to see your family.
He loves fashion, design, home decor, gifts, flowers, and event planning. And for more than 50 years, he's done all of that under the umbrella of his empire at 41st and Main, Trapp & Company.
And we sell more Trapp private garden candles than anyone in America. But you have to look at these. We just got these crazy t-shirts.
It's where you can find Bob all day long, sometimes 7 days a week running the show.
These are free spirit roses. Your eye sort of tells you that's the length that you want it to be.
He's always been on the go and in stellar shape, which is why what happened to Bob recently was so unsettling. He remembers he had just gotten out of the shower.
And I looked down, and the shower was covered, the floor was covered in blood, and my ankle, it was just sort of spraying out like that. And I freaked out.
Who wouldn't freak out? But Bob had the presence of mind to get a towel, wrap his ankle, and call his neighbor, who suggested he call his cardiologist. It was great advice. His cardiologist sent him directly to the University of Kansas Health System's Center for Advanced Vascular Care. That's where Bob was surprised to learn what was happening to him was something that could happen to anyone with varicose veins.
The veins were so close to the skin outside that just touching them almost, they would break.
At 84, he'd had varicose veins since he was in his 60s and had mostly ignored them.
You know, they didn't bother me, they didn't hurt, they're ugly, and you didn't let your legs be exposed at the swimming pool.
The fix was relatively simple. Remove the veins that were closest to the surface.
The technicians told me all about it, how they were going to do it. I couldn't quite believe it, but it was wonderful.
So wonderful and so quick that Bob was back on his feet full-time within a couple of weeks. And he has no plans of ever slowing down voluntarily.
People say, "Are you going to retire?" I said, "No. My prayer is that I fall over at my desk and boom, that's it, and it's gone." I like coming here. This is my love and passion.
Isn't Bob great? And Bob is in fact doing great. He recently, I was somewhere and I saw the prettiest bouquet and it was from Trapp & Company. So he's flourishing, he runs a great place. This morning we are thrilled to have yet another varicose vein patient with us today. She is Kristen Belko, along with interventional and vascular and structural cardiologist Dr. George Hodge. He treats all sorts of patients here at the health system for various things as a cardiologist. He happened to also treat Kristen for her varicose veins. So Thank you so much for both of you joining us. Now, Kristen, we know varicose veins can happen to anyone. You're so young. What age did you start to notice them on your legs?
Probably about 10 years ago, I started noticing that my legs were getting heavy, that I had some unsightly veins on my legs. I've been a nurse for, I've been at KU for 20 years, so a while, and I've just kind of noticed that they started getting worse as I got a little bit older.
And what kind of nurse are you?
I'm a nurse practitioner in the NICU.
So you're on your feet a lot.
Yes, I do stand a lot, more when I was a nurse, but definitely, you know, even sitting in my chair, constantly having to chart and stuff as when I became a nurse practitioner. So, yeah.
So you work with our tiniest, most vulnerable patients. Now, how did you discover Dr. Hodge? As a nurse, did you know that you needed to go to a cardiologist for your varicose veins?
That's a good question. No, I did not. I actually talked to my primary care physician, Dr. Langholtz, and she referred me to Dr. Hodge. And I was surprised because one of our nurses from the NICU is actually one of his nurses that I saw initially. And so that was really fun to see her. And I was surprised that you could do all of this at KU. I didn't have any idea. I didn't realize how bad mine were when I went to actually see him. So it was great.
And we're going to get, it's really incredible. The University of Kansas Health System has so many different branches of care. We have some before pictures that you were really kind to share with us. So I want to share them with our audience as we're talking about your journey. And I want to ask you, was there like a tipping point? Was it the heaviness in your legs that made you think, I got to get this taken care of?
Yes, it was definitely that. It was weird because my left leg was warm to the touch in that area that I had really bad varicosing, so that kind of made me a little anxious. It just was, I was working all day, my legs hurt all the time. I was working 3 to 4 days a week, 12 hours, and it was a lot. My legs would just constantly be kind of a dull ache, even when my days were off, so.
I want to bring Dr. Hodge in because I'd love to talk to you about the heart connection, because a lot of people don't realize when you hear cardiologist, you associate cardiologists directly with the heart. What do varicose veins then have to do with cardiology?
Well, varicose veins are oftentimes associated with problems with other veins that you don't see with your own eyes. You need an ultrasound to see, called superficial veins. These veins have valves that allows them to normally allow the blood only to go in one direction, towards the heart, not away from the heart. And variety of causes can make this not work well, whether we stand too long, whether we have some genetic preconditions or sit too long, or if there's really increased pressure inside the heart, these valves start to malfunction and cause the blood to flow in the wrong direction. And when that happens, that can lead to swelling or edema or puffiness in the ankles, but alongside that, there could be some varicose veins popping up as well. So sometimes these are associated just with problems in the vein of the leg itself, but sometimes they can be associated with heart conditions, especially if there's edema and swelling in the entire leg.
So Kristen, did you have any other heart conditions associated with your varicose veins?
I had an accessory saphenous vein in my left leg that ran down the middle of my left leg that caused pretty severe varicosing there. Everything else, I think, it was just from standing and not wearing my support hose. I know, Dr. Hodge, I'm so sorry. But
yeah.
Working on that. I wear those every day now, I promise.
Do you wear, when you say support hose, do you wear the whole actual hose, or do you just wear compression socks up to your knees?
That's a good question. So I actually have more issues in my upper legs, and so I have socks that start from my toes. Well, they aren't on my toes, and then they go all the way up to my thighs.
You know, we recently took a plane trip, and one of the doctors here said, a long flight, one of the doctors here said you should get compression socks, and our friends made fun of us, but the whole family got compression socks, and it was amazing. It felt like getting a massage. I want to ask about the procedure to fix varicose veins. And before we get into this video, I do want to say if you're squeamish, to our viewers at home, we're about to show you video of a procedure. Just be prepared. You might want to look away from time to time, but keep listening. We're showing some video, Dr. Hodge, of one of your fellow doctors performing a procedure to remove varicose veins, and I'd love for you to talk us through what we're seeing as this happens and tell us a little bit about how this works.
Yeah, so what we're looking at is marking of the bulgy varicose veins with a little marker, and after that the leg is prepped in kind of a sterile fashion to prevent infection. Now he's performing an ablation of the saphenous vein.
What does ablation mean in layman's terms?
Yes, an ablation is when we find one of these veins that I talked about that has these valves that aren't working properly anymore, and we introduce a small needle under ultrasound and then a wire, and then we pass a catheter. The catheter heats up this vein so that it stops these valves from allowing the blood to go in the wrong direction. Okay. And that's the black catheter that he's using to advance there. This procedure was coupled with what you're looking at now is a phlebectomy, and that's when we actually remove the varicose veins that you can't see with your own eyes. So a small needle is used to make a small poke in the skin, and then a little crochet is used to pull the vein out, and then a couple sets of Kellys are used to kind of gently grab the vein and gently take it out of the leg, one part at a time.
Question for you. I always think of veins as being flimsy, like you couldn't really pull at them without them breaking, which I don't know why I thought that. But it seems like you can really tug on them and they stay intact. You just pull them out?
It depends. Some of them are really tethered down there and you have to pull hard, especially the large ones. The small ones, they tend to break, so you have to pull very gently. And also you can see a little bit of circular movement. Sometimes from time to time you need to do a little circular movement to kind of untether it from the surrounding tissue. But sometimes they break. Then they break at their weakest points, of course. And then if there's a still remnant there, we can go back in there and take the remnant out as well.
Now, is that procedure similar to what you performed on Kristen?
Yes, Kristen had a microphlebectomy. She also had an ablation as well. Like she mentioned, she had an accessory vein, saphenous vein, that was leading, or what we call feeding, those varicose veins, because the blood, when the blood is going away from the heart towards the leg, towards the ankle, it needs a place to stay. And so when it needs a place to stay, it finds those little veins that are normally not seen under the skin, and it fills them up, it stretches them, and they become blue, tender, large, and that's what they become, varicose veins. So if you remove the varicose veins and don't treat the underlying cause, if you would, of why they happen in the first place, they can recur, they can come back. So it's important to do ablation of any vein that has reflux that's feeding into those veins, in addition to removing those veins, rather than just remove the veins to prevent them from coming back. Of course, other methods of prevention, like Kristen knows, is to wear compression stockings when you're sitting or standing, if it's an airplane travel, or if it's a long car ride, or if it's a job, like nursing job, or other jobs that require standing or sitting for a long period of time.
Like if you're a clerk
at
a store. Will insurance cover the removal of varicose veins?
Insurance covers all these procedures when they are coupled with symptoms, and when the patient has worn compression stockings, and despite that, symptoms continue. So insurance would cover all expenses as long as there's symptoms, and as long as we've tried compression stockings and there's still symptoms going on.
So just not liking the way they look, insurance won't cover it. You have to have some sort of feeling that's uncomfortable.
Yeah, they may be uncomfortable and unpleasant at the same time. But if they are just unpleasant to look at and have absolutely no symptoms, then usually it's not covered if it's just an aesthetic purpose. So an example of that would be spider veins that are not bleeding, because if they're bleeding, that's definitely need to be done and would be covered. But a spider vein is a smaller varicose vein that's not as bulgy, but it's not aesthetically pleasant. Those usually are treated with injections called sclerotherapy, which is different. We don't remove it, we inject the medication inside of it. That's usually not covered by insurance most of the time.
We have after pictures that Kristen shared with us as well, and I love seeing these because I know how happy you are now. Tell us about what your recovery was like and what it felt like physically once you were, coming out of this procedure.
So the actual procedure was very I could barely feel. I could feel him touching me, but it wasn't very painful at all.
So are you awake and conscious during the surgery? It's just a local anesthetic?
Yeah. Well,
Does it feel?
you put you put like a numbing cream on, and then you end up putting. They actually like inject, and Dr. Hodge would be able to tell you this, but it's like some sort of a sedative inside of your leg, like a local. And so then while they're doing it, they just kind of adjust that if you need more. And it feels kind of odd because it's like you can feel the veins kind of coming out, but it wasn't painful.
Does it just feel like a pressure, kind of?
Yeah, it just feels like you can feel things like kind of being taken out. Like, I don't know, it's just kind of like a stripping of your vein. You can kind of feel it a little bit. It feels a little weird, but it doesn't hurt. So,
right.
Yeah, it was great. You wear your compression socks for a while. After that, you have to wear them for a couple weeks or so. The only thing that was really annoying about those is that they're itchy, kind of hot. But those were all great, and I had a really good recovery. Some of the procedures are a little bit easier to recover from than the others. The actual, like when they pulled the veins out, they bleed a lot, but it doesn't take very long, and it's not terribly painful. Not like when you have like real surgery or anything like that. Like, I shouldn't say real surgery, but it's that kind of surgery where you're actually opening up a body part. And then I've had a couple of my spider vein treatments afterwards too with Bailey, who is the nurse that helps Dr. Hodge in the actual procedure, and then she did my spider veins too, and that's been really great. My legs look great. I just need to work out. Other than that,
but perfect time to be feeling great as we head into spring.
Yeah, I know. I'm like, can I buy shorts? What? I don't really own shorts. I might have to buy some.
That's so nice. We have plenty of community questions that are coming in, and we're going to get to those in just a moment because a lot of you want more information. We've also created a QR code for you on your screen. All you have to do is scan the QR code. It will take you to all the resources that we have available here at the University of Kansas Health System when it comes to treating varicose veins. And I want to get to some of our community questions because Margie has a good question. She wants to know, Kristen, do you know what caused your varicose veins? Do they run in your family?
That's funny. My mom has beautiful veins. She is a nurse and was a nurse for, she started in the 70s and just retired. But she always, part of their uniform was to wear hose every day to work, and she does not have any. I know my grandparents did, but they were, farmers, and my grandma was always cooking in the kitchen. So I know she did. So maybe, but my mom doesn't have any. So my sisters also, their legs look great too. So I don't know. I think it's just probably the fact that I'm just standing a lot at work.
Okay.
So, and then my accessory saphenous that I had, my extra saphenous vein, definitely. I don't know if I would have gotten my right leg treated as soon as I would have if the left leg wouldn't have looked so bad just from that extra vein that I had.
And so to piggyback on that question, Janice wants to know for Dr. Hodge, are they genetic, or could it be simply that poor Kristen just wasn't wearing pantyhose, which a lot of us don't wear pantyhose. They kind of fell out of fashion and now tights are coming back in. So like, it makes sense you wouldn't want to wear hose to work every day. Could that have caused hers?
It's both. So it's got a genetic predisposition to it. So if you have strong family history of it, multiple family members have them, then you're probably predisposed to have them.
Right.
But that doesn't mean that you can't prevent them by doing the right things. Try to elevate the legs, try to wear compression socks if you can't elevate the legs. So it's both lifestyle of prolonged periods of standing, prolonged period of sitting, and has some genetic predisposition. So it could be both, could be either or of these conditions.
Gretchen has a question for you, Dr. Hodge. She writes, I heard that women get them more than men. Is this true, and if so, why?
It is true. We do see a little bit more varicose veins in women than men. In fact, we also see them more prominently during pregnancy as well. And it has to do with the fact that female hormones tend to make the veins a little more lax and a little less tense, and that can lead to some of the reflux. And we typically don't treat the patients during pregnancy because we know after delivery, the hormonal changes will very frequently make the veins in better shape, so we wait till after to treat. So that is true. It has some. So obviously, this disease has multiple different causes or risk factors, what we call them. Some has to do with hormonal therapy, some has to do with lifestyle, and some has to do with genetics.
I have a question, because when I was little, my yaya always told me, only cross your ankles when you're sitting to the side. Don't cross your legs, because if you cross your legs too much, like knee over knee, it could cause varicose veins. Is that true, or is that just something yaya told me?
To a certain degree. I would say maybe if you're sitting on your leg, yeah, since the behind the knee vein is probably being compressed. So yes, if somebody is always sitting on their legs as a habit, it's probably not a great habit for leg vein health.
So, Kristen, did you get told that when you were growing up, and did that change how you sit and bend and all that, or is it just more you now wear compression socks and hose?
Yeah, no, we never talked about that. I mean, they do. I think they do say, and I don't know, Dr. Hodge could probably say this better, but your blood pressure goes up a little bit more when your legs are crossed, even if it's crossed.
Okay.
Like that. So maybe that's a little bit to do with it. I don't know, but no, we never had any. Never was told anything like that. I mean, the NICU is hot all the time.
Right.
It's like 74 degrees for the babies, so that's probably the main reason that you won't see very few of the NICU people wearing compression socks or hose or anything, because it's so hot already.
Right.
So.
Dr. Hodge, I have a question from a man named Brett. Brett wants to know, do all cardiologists treat varicose veins, or does someone with varicose veins always need to see a cardiologist?
No, not all cardiologists treat varicose veins. It is a subspecialty within cardiology, as well as within other specialties as well. So some cardiologists do. They do training for that as part of what we call vascular cardiology.
Right.
Most of the time, vascular cardiology also involves treating arteries as well as veins. Do they have to see a cardiologist? They don't have to unless they see a varicose vein specialist and the specialist have reasons to suspect there is a problem in the heart contributing to whether there's a lot of swelling, a lot of other signs and symptoms that are indicating maybe there is an increased pressure inside the heart that's contributing to the swelling in the veins in the legs. Then they get referred to a cardiologist. So not every varicose vein patient has heart problem for sure, but on occasion there could be. Yeah.
So that brings me to a question from Alice, because Alice wants to know, related to her husband, how do you know, because her husband has varicose veins, if they're a serious problem like the first man, Bob, we saw where his ruptured, or if they're just unsightly. Should you see a doctor even if you're not feeling pain, just to make sure there's not a heart problem?
If there's associated swelling and edema in the legs, I would say yes. Even if there's no pain, but if the ankles are swelling up, then yes, I would start with the regular doctor, primary provider. If they don't have to have pain, they could be heaviness, it could be itching, it could be tenderness, it could be fatigue of the legs at the end of the day. So it doesn't have to be this sharp pain that people associate with. And sometimes you don't know how not so well your legs feel until they feel well.
Because it's normal to you. You don't have anything to compare it to.
Things, yeah.
Alice wants to know, is there any risk to the procedure to treat varicose veins?
There are very small risks. Infection is one of the risks, so we take extra precautions in that. We prep the leg extensively with sterile fashion, so and we instruct the patient if there's any redness to take pictures and let us know, or come back to take a look at things. Bleeding is another risk. Usually the bleeding is mild because veins don't have high pressure, unlike arteries, so mostly all bleeding can be controlled by pressure. On rare occasions we put stitches and they come back to remove the stitches if the incision we made is a little too large, or if the bleeding is hard to control, or if the patient is on blood thinners. We typically don't hold blood thinners for these procedures. We let the patient continue taking their blood thinners and go ahead and do it, due to the fact that the bleeding risk is very, very low. Blood clots from ablation can happen, and the patients get an ultrasound the next day or two to rule that out. The chance of that is less than 1%. If that happens, most of the time it's a small blood clot that we just watch. On rare occasions we use blood thinners for that for about a week, but that's very, very rare.
I just want to acknowledge our patient, because Kristen, not a lot of people would agree to go on television if I basically hit you up with, hey, there's something you're really self-conscious about. Can you show us your legs on TV and the part you're most self-conscious about? And you're doing that. So thank you, because you're helping so many people who have the same thing. They're very common. So just wanted to give you a nod that it takes guts. I know you're in the medical profession and you're probably, it's clinical to you, but it's a big deal and we really appreciate it.
Yeah, no problem. I talk about it a lot, to tell you the truth. And like,
That's awesome.
I was at the pool last summer with all of my stuff on, and people are like, what are you doing? Like, what's wrong with you? And so I tell everybody, I'm like, you don't have to wait till you're 80 years old to get your stuff done. You know, like, let's fix this stuff now. If you have issues now, I have friends that, you know, I think have the same issues I had with that extra saphenous vein. I'm like, you need to go get that looked at. You know, they don't want to wear. Just being self-conscious is, you know, world's hard enough. You don't, you know, enjoy your life and try to, you know, do all the fun things, including go to the pool.
Oh, absolutely. Wait, so what were you said you had all your stuff on at the pool. What were you wearing that people were asking?
Yeah, so like after I had my procedures, I would have to wear my compression stockings. You have to wear them for a little while afterwards during the day, especially when
so you wore them to the pool?
Yeah, well, I have kids that I would take to the pool
that.
and they would swim, and everyone would be like, "What are you doing?" And I'm like, "Yeah, it's part of
living your
the
life
procedure."
and unapologetically. Yeah.
Yeah, I was like, it's kind of a process, you know, the whole thing. You know, you do different legs on a different day. You do some of the pieces at different times, so you just kind of go through it. And because it was covered with my insurance and you have a max out of pocket, you know, you pay for all this stuff. I was trying to get it all done, you know, within the year. So it's even during the summer, which was fine. Yeah, it worked out awesome. And now this summer I'm ready to go. Even after a couple of Bailey vein, spider vein treatments, I am happy as a clam. So
that's fantastic. And I think you just answered Wendy's question, because she wanted to know, are there things you're doing now you didn't want to do before? And you said, Wendy wrote, I'm inspired to do something about mine now.
Yeah,
so,
I just enjoy your minute. And Dr. Hodge is so, you know, they're talking you through the whole procedure and he's there. You're just kind of goofing off the whole time they're, you know, doing their procedure and talking about life. And it's great. It's a very calm experience. It wasn't nerve-wracking at all. I had a great time. So I appreciate you guys so much, Dr. Hodge and Bailey and Taryn and everybody there. So, oh my, everything's great.
That's wonderful. And I wanted to bring both Kristen and Dr. Hodge back on for some final thoughts. And to go along with what you're saying, what would be the main thing that you would want? Do you have little ones in the room talking to you? It's all right. What would be the one thing, I think we have her audio still, that you would want people watching to know? What's the one thing? Yeah.
Yeah. Like I said, just you don't have to wait. You don't have to wait till the last minute to get it fixed. You know, I know that people do wait because they see it as cosmetic, and your veins are not working. So it's not really a cosmetic thing, and it does affect your life. So if you're having those issues, get them treated as soon as you can. Yeah, get them done.
Dr. Hodge, she gave you some really nice compliments, because it's stressful when you're getting things done, and you made it fun. You made varicose vein removal fun, is what I think I heard her say.
We tried.
It was fun. We had a good time.
We tried. Yeah, you know, the environment is fun. There's music on. We're just chatting with the patient. We're just talking about life. We're not talking about what we're doing unless the patient wants to.
Right.
Try to take their mind off of what we're doing. So as we're doing what we're doing, we're really not talking about it. We're just talking. We're getting to know them. They're getting to know us. We're talking about their personal life, our personal life, and before they know it, no, we're done. So
that's a talent in itself, to make people feel comfortable while you're doing something really important on their bodies. We're not done with this conversation yet, so I want to start this next segment that we love bringing you.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
This morning we're going behind the mask with Dr. Haj because you are an adventure machine. You sent some incredible pictures, but I want to start with the sweet stuff because you also sent some very sweet family pictures. So tell us who we're seeing in these pictures.
That's my sister and my parents, and that's in Disney in Florida.
Disney, and then you sent some adorable pictures of a little tiny human being.
That's
Who's this?
My precious William. William Peter.
Yeah.
He's 2.5. So that was his second birthday.
And the son is your son is basically your sunshine.
That's right.
Oh, and what's he doing here? Just driving the golf cart?
He loves to drive that little bus.
A little bus, okay. You could probably take him golfing with you if his feet wouldn't reach the pedals, but he could go along.
He's still little. Those are my niece and nephew, Nicole and Henry, and that's William in my hands.
You sent us a lot of pictures of kids climbing on you with big smiles, and I love that. And I want to also go to your adventure pictures because this one I love. Where was this dolphin photo shoot done?
That was in Dubai, actually.
Dubai.
Few years ago, actually. Yeah, that was. They just let you go in there and just swim with them, and they just mingle with you.
And from the water,
unique experience.
We go to the fields where you're on a horse. Where do you horseback ride?
I haven't yet here, but I used to a lot before. This was on a trip. This was in Hawaii, I believe. I do love horses. They're my favorite animals. It's hard to own one because of how much care and maintenance it takes to care for them. So probably next plans would be to try to just, I used to have friends who have horses all the time, just go, help them out with them and ride. Probably the best plan is to have somebody care for the horse and still enjoy
and you can just
some of the work. Yeah, I still enjoy doing some of the work too. It's a connection with the horse.
We have two more sports. Okay, at first I thought you jumped out of a perfectly good airplane, but it's actually more extreme than that. You jumped off a perfectly solid mountain.
Yeah, that was in Switzerland.
Okay, what do you mean you jumped off a mountain though?
You just basically run as fast as you can, and it's a downhill mountain, and then eventually this kind of big, huge umbrella behind you gets lifted by the wind, and then as you're running, your feet are in the air, and then you go down to town from there.
But how do you know where you're going to land?
Well,
and how do you know that umbrella? I mean, I'm sure there's a different name for it than umbrella, but how do you know it's going to inflate and you're going to be cool?
So there is an instructor right behind you who has ropes right and left steering it, and he's the one taking the picture too, obviously with that little kind of long stick shift, and then they take videos of it too, but he can steer it as long as the wind is reasonable and the weather is nice. And in fact, we had to wait hours to kind of find a window between the clouds so that we can see where we're going to land.
Right.
It wasn't for sure thing it's going to happen, but it did happen, and it was a wonderful experience. Yeah.
Dr. Hodge, is this something you Googled and just decided I'm going to try that, or like is this a one-time thing, or something you're going to just keep doing, jumping off mountains?
Well, it's fun. It's hard to do here in this area, so you have to travel. So usually it's part of travel plans. It's usually part of a travel that you'd say, I would hope the weather would cooperate, that I would be able to do this, and you'd communicate with them ahead of time before you book your trip. And usually the trip is not a 1 or 2 days. For being there is multiple days, and you have to be flexible which day to go depending on the weather for that particular experience.
Oh, you lead a very exciting life outside the surgery room, outside the OR. Thank you for being here. I know you have patients to see today and you have a busy schedule, and you took time to join our conversation, so thank you. And thank you to Kristen again.
Thank you for having me.
For sharing your journey. You're going to help so many other people who have the same thing but just didn't know who to ask or weren't comfortable asking about it, so thank you. Coming up next week on All Things Heart.
I think our biggest concern was having open heart surgery. I mean, just the sound of it is scary.
You think? Open heart surgery, yes, that can be scary to the average person. Now imagine it with the help of a robot. The alternative technique that had a patient recovering at home just days later. That's next Thursday morning at 10 a.m.